Hey, this is Dr. Jen Peña, and I'm here to talk about all of the headlines in sexual and reproductive health that have been on your group chat. So welcome to Doom Scroll.
Jen,
Zoey.
we got to chat. One of the things that's come up in headlines that I was like, I need to understand this better and why I'm calling you today is about what's going on in Iowa.
Essentially, Iowa has a new attorney general, and this new attorney general has paused the practice of paying for all services for sexual assault victims. That includes emergency contraception and in sometimes even abortions for victims of sexual assault. So that's hard, right? Because imagine, God forbid, you're a victim of sexual assault. You're scared, you're in a difficult situation, you're trying to get care, and now you also have to think about how you're going to pay for it. The way that I read the law in Iowa is that it does cover the examination of sexual assault victims, as well as any treatment for sexually transmitted infections. Very important.
Is there a financial reason behind this, or is this more political or social driven?
All it says is that they're doing an audit. Top down, bottom up is what they said, audit of the process to make sure that it is an appropriate use of public funds. As you can imagine, there's huge outrage because of this across the US, because some of the concern that I'm hearing from my friends and patients is, well, what other states are going to start doing the same thing? Remember, this is coming at a really crazy time for sexual and reproductive health. And it's only been a year since the Supreme Court overturned Roe v. Wade. And in this past year, if you've been watching the headlines, you've also probably seen that there's a lot of back and forth at the federal law level happening in terms of the abortion medication mifepristone. And you've got some federal judges in certain states, like Texas, who are calling for a federal hold and banning of mifepristone. And then you have some other federal judges in DC, right, that are calling for it to be approved at the federal level. And so that leaves a lot of gray area in terms of which states will and will not approve the abortion pill, which again, very different from emergency contraception. So this gets complicated, right? We have to go into the nuances of it. At the end of the day, what's the take home? The take home is that if you happen to live in a state that is one of the more prohibitive states, like Iowa, and you happen to be an unfortunate, victim of sexual assault, you have to know what your state, what the laws are, because that has implications for you, and it has implications for decisions that you have to make really quickly at a very precarious time if you happen to be one of these victims, unfortunately. Thank you, Zoey.
Thank you. I'll talk to you soon.
Bye.
Bye.